Have you ever stopped to think how a simple white powder, found on any supermarket shelf, can divide opinions worldwide? We're talking about sodium bicarbonate. It's in millions of homes, used in baking, cleaning, and even as a home remedy. But what few people know is that, despite its harmless appearance, baking soda can be both an ally and a real health risk, especially after the age of 50. According to international data, an estimated 1 in 3 adults worldwide regularly uses medications or natural substances to treat heartburn, acid reflux, or stomach discomfort. Sodium bicarbonate is among the most popular. In the United States alone, for example, over 60 million people suffer from regular acid reflux, and many turn to baking soda for quick relief. But is it really safe? Or are we facing a silent danger? Today, I'll reveal the truth that only 2% of people truly know about sodium bicarbonate. We'll uncover its benefits, its hidden risks, and most importantly, when it can help and when it should be avoided. If you're over 50, this video could change how you view this common household product. Now, pay close attention, because what comes next could protect your health and the health of those you love. Sodium bicarbonate may seem simple, but inside the body, it performs a very specific job. It's an acid neutralizer. Our bodies function like a well-regulated machine. One of the key controls it maintains is the acid-base balance, the level of acidity and alkalinity in the blood and organs. When ingested, baking soda acts as a temporary fire extinguisher for excess acidity, especially in the stomach. This is why many people turn to it for heartburn, reflux, or that uncomfortable burning sensation. Baking soda reacts with stomach hydrochloric acid, forming water, salt, and carbon dioxide, the gas that causes the famous burp right after consumption. But it's important to understand that the relief is temporary. It doesn't treat the root cause of the problem, only neutralizes the acid for a short period. Frequent, unguided use can mask more serious conditions like gastritis, ulcers, and even esophageal issues. Additionally, sodium bicarbonate is a source of sodium, the same element found in table salt. And since many older adults already need to limit sodium intake to protect their heart and kidneys, this is a critical point that cannot be ignored. Now that you know how baking soda works inside the body, let's explore the first major benefit it can offer those over 50. Benefit 1. Quick relief from heartburn and acid reflux. As we age, changes in the digestive system are common. The valve separating the stomach from the esophagus can weaken, allowing acid to flow back into the esophagus, causing heartburn and reflux, symptoms that affect millions worldwide over 50. In this scenario, sodium bicarbonate can be a temporary ally. When it comes into contact with stomach acid, it quickly neutralizes acidity, relieving that burning sensation and discomfort. Because it acts almost immediately, many people use baking soda as a quick fix for unexpected heartburn. And indeed, when used occasionally and in small amounts, it can provide relief without major consequences. However, caution is crucial. Frequent use can pose serious risks. Excess can disrupt blood pH, cause fluid retention due to sodium, and even worsen high blood pressure, heart failure, or kidney issues, common conditions among older adults. Therefore, baking soda should not be used as a continuous treatment for reflux. If heartburn is constant, it's a sign of an underlying issue that needs medical investigation. Now that you understand how baking soda can help and the precautions it requires, let's move to the second benefit, its role in relieving muscle and joint pain. Benefit 2. Relief from muscle and joint pain in therapeutic baths. With age, muscle pain, cramps, and joint discomfort become unwelcome companions for many. Morning stiffness, swollen knees, back pain after a long walk. These become part of life after 50. This is where sodium bicarbonate can offer a simple yet often overlooked benefit: therapeutic baths. Adding 1 or 2 tablespoons of baking soda to a tub or basin of warm water creates a solution that can help relax muscles, ease minor inflammation, and reduce joint pain and fatigue. Baking soda works by neutralizing skin impurities and slightly easing muscle tension, turning the bath into a moment of relief and well-being. This relaxing effect can be especially helpful after walking, light exercise, or a tiring day. But here's an important note. Baking soda doesn't replace medications, physical therapy, or medical treatments. It should be seen as a complementary, natural way to care for the body, always in moderation. Now that we've covered muscle and joint pain relief, let's move to the next benefit, particularly relevant for mature skin: care for dryness and age-related itching. Benefit 3. Care for dry skin and itching common in older age. After 50, the skin undergoes natural changes. It loses moisture more easily, becomes thinner, more sensitive, and prone to irritation. Minor itching, redness, and flaking become more frequent, especially in dry or cold weather. At this stage, sodium bicarbonate can offer simple, safe relief when used topically and sensibly. Added to warm bath water, baking soda helps soften the skin, reduce itching, and remove minor impurities from pores. Its mild alkaline action can neutralize acidic irritants, providing immediate comfort. Those with mild dermatitis or contact allergies often notice improvement after the first few uses. But balance is key. Overuse or high concentrations can further dry the skin. The recommendation is to use a small amount in warm water, with immersion not exceeding 10 to 15 minutes. And of course, any severe skin changes should always be evaluated by a dermatologist, as baking soda doesn't replace proper medical treatment. Now, let's move to a benefit many overlook but that affects countless people over 50, oral health and combating bad breath. Benefit 4. Improved oral hygiene and bad breath control. With age, oral health demands more attention. Saliva production decreases, promoting bacterial buildup. Additionally, dentures, tooth wear, and common medications in this age group can contribute to halitosis, bad breath. Sodium bicarbonate can be a helpful daily aid. By balancing oral pH, baking soda reduces mouth acidity, hindering bacteria that cause bad breath. Its mild abrasiveness also helps remove plaque and food residue, complementing brushing. Some prepare a simple solution: half a teaspoon of baking soda diluted in a glass of water, used as a mouthwash for 30 seconds, once or twice weekly. This practice freshens breath and cleanses the mouth without harming tooth enamel. But remember, baking soda should never replace toothpaste or regular dental visits. Daily or excessive use can erode enamel over time. Now, let's explore a surprising benefit: baking soda as a natural deodorant, especially for sensitive skin. Benefit 5. Odor neutralization as a natural deodorant. Aging changes sweat gland function. Some notice shifts in body odor despite good hygiene. Mature skin may also grow more sensitive to chemicals in conventional deodorants. Here, baking soda emerges as a natural, accessible option. Its key property is neutralizing skin pH, reducing odor-causing bacteria. Unlike commercial deodorants, it doesn't block sweating but targets odor directly. To use, apply a small amount of pure baking soda to dry skin after bathing. Some mix it with cornstarch or coconut oil for a gentler paste. Always test a small area first. Older skin is thinner and more sensitive. Continuous use may cause irritation, redness, or itching. If so, discontinue use. Now that we've covered the top 5 benefits, let's address critical risks often ignored, especially by those over 50. Baking soda and kidney health. What older adults must know before use. Kidneys filter blood, remove toxins, and balance minerals and fluids. With age, they naturally lose efficiency, even in healthy individuals. Baking soda can indeed burden the kidneys, especially in seniors. It contains sodium, and excess sodium increases fluid retention and pressure the kidneys must manage. In specific cases, under medical supervision, baking soda may be prescribed for chronic kidney disease to manage metabolic acidosis, an acid-base imbalance. But here's the key: this should only be done with strict professional oversight. Uncontrolled use, even in small doses, can cause fluid retention, high blood pressure, swelling, and, in severe cases, worsen kidney function. If you have kidney disease, high blood pressure, or heart issues, avoid baking soda or use it only under strict supervision. Never self-medicate with the idea of helping the kidneys. The risk is real. Now, let's discuss another common, underestimated danger: excessive, unguided use of baking soda as self-medication. The danger of self-medication. Why baking soda isn't as harmless as it seems. It's common, especially among older generations, to turn to home remedies like baking soda for discomfort. It's cheap, accessible, and seems safe. But here's a critical warning. Just because it's over-the-counter doesn't mean it's risk-free. The biggest issue with self-medication is the false sense of immediate symptom control, especially for heartburn and reflux. Frequent use can mask serious problems like chronic gastritis, ulcers, hiatal hernias, and even esophageal damage. Chronic use can also disrupt blood pH, leading to metabolic alkalosis. Early symptoms may be subtle: weakness, cramps, confusion, and irregular heartbeat. Over time, these can become severe, especially in older adults with reduced adaptability. Excess sodium is another critical factor. Each dose adds significant sodium to circulation, dangerous for those with hypertension, heart failure, or kidney issues. Baking soda should be an occasional resource, not a continuous solution. Now, let's address a specific concern: baking soda use in diabetics and pre-diabetics. Baking soda and diabetes, risks and precautions. Diabetes is highly prevalent among those over 50. Globally, over 500 million live with type 2 diabetes, a number rising with aging populations. For this group, baking soda requires extreme caution. In rare cases of metabolic acidosis, blood becoming too acidic, baking soda may be used under hospital supervision to temporarily balance pH. Outside these controlled settings, free use by diabetics is risky. Excess sodium can worsen fluid retention, blood pressure, and kidney strain, already burdened by diabetes. Moreover, baking soda has no direct effect on blood sugar control. It shouldn't be used with false hopes of detoxifying or cleansing the blood, as some internet myths suggest. Diabetics should only use baking soda with medical guidance, especially with heart, kidney, or hypertension issues. Next, let's discuss another overlooked risk: baking soda's interactions with long-term medications. Drug interactions, hidden dangers for those on long-term medications. With age, polypharmacy, multiple medications, becomes common: antihypertensives, diuretics, anticoagulants, cholesterol and diabetes drugs, and more. Few realize baking soda can silently interact with many of these. By altering stomach and blood pH, it can interfere with drug absorption, reducing efficacy or amplifying side effects. Certain antibiotics, antifungals, and even antihypertensives may be affected. Increased sodium can also hinder medications meant to control blood pressure and fluid balance, like diuretics and heart failure drugs. In some cases, excessive, unmonitored use may raise the risk of cardiac arrhythmias. Those on regular medications, most over 50, must consult a doctor before using baking soda. Now, let's explore a curious question. Can baking soda really enhance physical performance in active seniors? Baking soda and physical performance. Does it work for active seniors? More people aged 50 plus, 60 plus, and even 70 plus are adopting healthy exercise habits: walking, swimming, light weightlifting, cycling, and recreational sports. Some studies have explored whether baking soda could improve performance. During high-intensity exercise, lactic acid builds up in muscles, causing fatigue and pain. In theory, baking soda could neutralize this acid, boosting endurance. However, these studies focused on young athletes in maximal efforts. For older adults doing moderate exercise, baking soda's effect is minimal and usually unnecessary. Potential side effects: stomach discomfort, diarrhea, bloating, and excess sodium outweigh any benefits for this age group. Active seniors should stick to adapted exercise, good nutrition, hydration, and professional guidance. Baking soda isn't recommended here. Now, let's address a crucial point: who should absolutely avoid baking soda without medical advice? Who should avoid it? Hypertensives, heart patients, kidney disease, and other high-risk groups. While baking soda has occasional benefits, certain groups over 50 face significant risks or contraindications. First, hypertensives. Baking soda's sodium can raise blood pressure over time, straining the heart and increasing stroke and heart attack risks. Second, heart failure patients. Their bodies already struggle with fluid and sodium balance, which can worsen swelling, shortness of breath, and severe complications. Third, kidney disease patients, even in early stages. Impaired kidneys can't efficiently remove excess sodium or maintain blood pH. Unsupervised use can accelerate kidney decline. Those with severe respiratory issues, advanced lung disease, or metabolic disorders also face higher risks of metabolic alkalosis. Pregnant women and those on long-term medications, as discussed, also need medical evaluation before use. If you're in any of these groups, consult your doctor before considering baking soda, even in small doses. Now, let's answer a common question. Is there a safe amount? If so, what is it? The safe amount. How to use responsibly and with medical oversight. Given the risks, a natural question arises. Is there a safe, occasional dose of baking soda? The answer, yes, but with extreme caution and preferably under professional guidance. For occasional heartburn relief, international medical guidelines suggest up to half a teaspoon of baking soda dissolved in a large glass of water, consumed slowly. This dose should be limited to once or twice daily, never for more than 2 consecutive days unless a doctor approves. Never consume baking soda undiluted, it can harm the esophagus and stomach. For topical uses like baths, 1 to 2 tablespoons in a tub of warm water usually suffice for mild skin irritation or itching. For oral hygiene, limit use to 1 to 2 times weekly, always diluted, to avoid enamel erosion. The key takeaway: baking soda isn't a daily habit or long-term solution for chronic issues. It's a temporary aid, not a treatment. Frequent need for it signals an underlying health problem requiring proper medical attention. Now, we reach the final summary, the definitive truth about baking soda after 50. Sodium bicarbonate is undoubtedly a staple in homes, family remedies, and daily life hacks. It offers occasional benefits for those over 50, temporary heartburn relief, muscle relaxation in baths, sensitive skin care, oral hygiene, and body odor control. But as we've seen, baking soda is far from harmless. Excessive, prolonged, or unguided use poses serious risks, especially for those with hypertension, heart or kidney disease, diabetes, or on long-term medications, the profile of many older adults. The greatest danger is self-medication. Treating baking soda as a miracle home remedy is a grave and sadly common mistake. The bottom line: baking soda can be used occasionally and moderately, always with professional advice, and never as a substitute for proper medical treatment. Health after 50 requires balance, reliable information, and responsibility toward your body. Remember, what seems simple often hides risks only proper medical care can identify. Now that you know the truth about baking soda, share this video with family and friends. After all, accurate information can protect many lives.